Hi, this is Dr. Sampson Davis, and this is how you treat a nosebleed. So, the most common cause of nosebleed, people always ask, how does it happen? Here's the number one common cause: nose picking. Digital trauma is what we call it in the emergency department. I see so many patients come in with blood all over their shirt and bleeding profusely and just noses bleeding out of control. And what causes it is usually digital trauma or some sort of dry heat. So the first thing you want to do to stop the bleeding is compression. You want to squeeze the nose. You want to grab it from one side and grab it from the other side and squeeze tight. You take a gauze for that and sort of squeeze. You then want to make sure while doing that that you're leaning forward, because what you don't want to happen is lean back and the blood from the nose will go down your throat, which is connected to your mouth. Your nose and your mouth is connected in the back. And that blood would trickle down into your stomach, make you nauseous, and cause you to vomit. So you just would just throw up blood all over the place. And that would freak you out. I'm telling you, it would make you go crazy. And then plus the blood cells are very sticky. They stick to one another. So often I see patients come in and they're leaning back, and so the blood goes to the back of the throat and they form this long blood clot that they pull out, and it's just so disgusting and nasty, and people are totally freaked out, shocked by the blood. I remember being in medical school and I couldn't stand the sight of blood at first, and ideally I got used to it, of course. And so you want to make sure you compress, you want to make sure you lean forward. You want to hold that compression for 3 to 5 minutes and see if that stops it. Ice also helps as well. If you feel like it's not working with the compression, you can put a nose ice pack on the top of the nose to help with the bleeding as well. Do that. If all else fails, I'm in the emergency department. Come see me. I'll take care of you. For those of you that are on blood thinners like aspirin or Coumadin or warfarin or Xarelto, you may have to squeeze a little bit longer and to stop the bleeding. But take these steps. Also make sure you check the heat in your house, because dry heat as well causes the capillaries inside the nose, the lining, the mucous membrane on the inside, the lining of the nose, to be very brittle and cause you to bleed. Now, once the bleeding stops, what you want to do is grab some Vaseline or Neosporin or Bacitracin. You want to line the inside of your nose with that substance in order to help, one, serve as a barrier, and two, help moisturize the area. These are tips on how to prevent and stop your nosebleed.